Ever heard of a pilonidal sinus? If not, you're in for an enlightening discussion. Today we're talking about a condition known as pilonidal sinus. It's a small hole or tunnel in the skin, often occurring at the top of the buttocks. It's a common condition and can cause discomfort if not treated properly. Understanding it is the first step towards managing it. Defining a pilonidal sinus is quite straightforward, but what about its causes? Let's delve into that next. So what triggers a pilonidal sinus to form? The answer lies in our lifestyle and genetics. Just like many other health conditions, pilonidal sinus has multiple causes. A sedentary lifestyle is one of the primary culprits. Sitting for prolonged periods, especially on hard surfaces, can put excessive pressure on the coccyx area, leading to the formation of a pilonidal sinus. Obesity is another factor. Excessive weight increases pressure on the tailbone region, which can induce the condition. Hair growth, particularly in the natal cleft, also contributes to the problem. Loose hairs can penetrate the skin, creating a pathway for bacteria to enter and cause infection. While anyone can develop a pilonidal sinus, it's more prevalent in young, hairy men. Hormonal changes during puberty can result in increased hair growth, making teenagers and young adults more susceptible. Understanding the causes helps us to prevent and manage the condition. But what if it develops? What are the symptoms? That's what we're going to discuss next. Pilonidal sinus doesn't always cause noticeable symptoms, but when it does, you'll want to pay attention. The primary symptoms of pilonidal sinus include pain and swelling at the base of the spine. You may also notice a small dimple or a large swollen area, often filled with pus, known as an abscess. These abscesses can be quite painful, and you might even experience discomfort when sitting or standing for prolonged periods. But what happens if a pilonidal sinus is left untreated? Well, complications can arise. The most common complication is an infection, which can further lead to the formation of more abscesses. In severe cases, the infection can spread, causing cellulitis or sepsis, both of which are serious conditions that require immediate medical attention. With such discomforting symptoms and potential complications, you must be wondering about the treatment options. Cue Dr. Karan R Rawat. When it comes to pilonidal sinus treatment, India boasts one of the best proctologists, Dr. Karan R Rawat. Modern advances have led to minimally invasive techniques, transforming the way we approach this condition. Dr. Rawat is at the forefront of these advancements, utilizing his expertise to provide effective, compassionate care. Being one of India's leading proctologists, he's a beacon of hope for those suffering. So, if you or someone you know is dealing with a pilonidal sinus, remember the name Dr. Karan R Rawat. That's all for today. Stay healthy, stay informed.